For pain control, if somebody has been on a medication that works and they trust it works, it's hard to talk then about switching, and knowing that most meds can be crushed and given through the Macy. We don't have to worry about switching a med.
With the sublingual medications, the risk for aspiration is really high with the higher doses. We never really know how much they're getting, how much they're absorbing. Often they spit it out or swallow it, or it drains out of their mouth. So it's really hard for us to get an idea of how well it works and what dosing.
We put that little syringe into the buccal there. Sometimes you see fluid running out. We don't know if it's saliva. We don't know if it's medication. But now we know they get all the medication.
From a nursing perspective and a family perspective, more timely symptom management is always our goal.
We can escalate our doses and things quicker and get people comfortable faster. And when you think about CADD pumps, talk about delay. Do they have the med? Do they have the volume? How do you get it? What pharmacy? Here we're using contingency that we have in a Macy that we have, and not having to send a prescription for anything else to the pharmacy. So our time to initiate something is as minimal as it can be.
We use CADD pumps a lot for the continuous administration or oral, but we did have problems then with accumulation of secretions. If we did use the rectal method, it was the discomfort of having to move the patients more often. With the Macy, this isn't a problem. You can administer medications every hour if needed without discomfort to the patient. I've never had one patient that's ever expressed any discomfort with having the Macy in place.
When you're there and you have that 4 hours of constant interruption with the CADD pump going in every 20 minutes, you have to displace the family, turn on the lights. The beeping of the CADD is terribly, disturbing, and just interrupts that time that family is spending with the patient. And you have to have 2 nurses to check off all your dosing. So they have to move, they have to get up so that we can come in and adjust these pumps. Whereas when we switched to the catheter, I could just come in by myself. We drew everything up in the other room. We just came in with the syringe and flush, just sneak alongside because the catheter's down, further on the leg, not up higher. It's quiet. You just push it in. We're very unnoticeable.
We were using subcutaneous CADD pumps, which was an easy way to get access, but again, much more technologically challenging. And now I feel confident that if we're in that situation, we can go to the Macy.